Today we are reporting 996 cases of COVID-19 in our community, an increase of 14 cases from yesterday. 1 person is a worker in the agri-farm sector. 6 cases are community acquired. 2 cases are close contacts of confirmed cases, and 5 people right now remain under investigation at this time. 566 cases have resolved. 20 people remain in the hospital. 19% of our cases are between the ages of 20 and 29 years. 18% are between the ages of 30 and 39 years. And 16% of our cases are 80 years or older. 48% are male and 51% are female, with 1% unknown at this time. Our community has lost a total of 66 people to COVID. 49 people have died in residents in long-term care and retirement homes. Our health unit is currently working with 2 long-term care and retirement homes that are experiencing a COVID outbreak. Testing is available for symptomatic people, those who have at least 1 symptom of COVID-19, even mild symptoms. And testing is also available for asymptomatic people based on their level of risk, including people who are concerned that they have been exposed to COVID-19, people who are contacts of a confirmed case, or who may have been exposed to a confirmed or suspect case of COVID-19, and people who are at risk of exposure due to their employment, including essential workers such as healthcare workers, grocery store employees, and people working in food processing plants. No one who is symptomatic or who is concerned that they have been exposed to COVID-19 will be declined a test at an assessment center. Common symptoms of COVID-19 include fever, a new or worsening cough, and shortness of breath. However, other symptoms may be present, such as a sore throat, difficulty swallowing, unexplained fatigue, an increase in falls, nausea, vomiting, chills, and headaches. To access a local healthcare provider, walk-in clinic, or virtual medical assessment, please visit ehealthwindsoressex.ca. Windsor-Essex has 2 COVID-19 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Aulette Campus. SOHAC, the Southwest Ontario Aboriginal Health Access Centre in Windsor, also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at WECHU.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, and thank you for joining in again. I want to start off today to clarify a few questions that have been continued to arise related to reporting of statistics and testings for COVID-19. Under the Ontario Public Health Standards, public health units are required to conduct surveillance activities. Public health surveillance is the systematic collection, analysis, and interpretation of health information for planning and evaluation programs. The Ontario Public Health Standards outlines the assessment and surveillance process as data analysis and interpretation, reporting and knowledge exchange, and data access collection and management. In health units, trained epidemiologists primarily complete data analysis and interpretation. Epidemiology is a specialized field of scientific study with specific methods and tools. Epidemiologists study diseases in population, including frequency, trends, and determinants, as well as outbreak management and response. This information is used to provide recommendations for interventions and programs to prevent and mitigate risk in the community. The Windsor-Essex County Health Unit has 3 epidemiologists working every day to collect, analyze, interpret, and report information in a timely manner. Public health units are required to share information for knowledge exchange purposes with residents and community stakeholders. Information shared must not violate any legislation, such as Personal Health Information Protection Act, and must not be identifiable in any ways. During COVID-19, the Windsor-Essex County Health Unit has consistently reported daily information to the public, including the number of positive cases, number of resolved cases, deaths, age distribution of cases, sex of cases, exposure type, status of cases, number of cases in long-term care home and retirement home, number of cases in healthcare workers, and total number of outbreaks. Additionally, as information and available data increase, the Windsor-Essex County Health Unit shares the following information during our weekly epidemiological summaries. Epidemic curves to display cases over time, incidence rate compared to the province, percent positivity, percent of positive cases reported to the Windsor-Essex County Health Unit and investigated within 1 day, underlying chronic conditions of cases, most commonly reported symptoms, geography of cases by municipality, hospitalization and ICU trends over time, case fatality rate, age and sex breakdown of deaths, day-over-day doubling time, cumulative doubling time, the mean reproductive number. The amount of data and breakdown of data reported by Windsor-Essex County Health Unit is consistent with other health units across the province and exceeds the reporting of many, including most health units in the Southwest region. As well, the Windsor-Essex County Health Unit continues to monitor and report disease trends, substance use-related data, mosquito surveillance data, and other required public health reporting, which are made available on our website. Currently, there is no antibody testing for COVID-19 in Windsor-Essex. COVID-19 testing is a point-in-time test. A person can test negative and then become exposed the next day and test positive later. Testing does not replace the need to follow prevention measures and public health guidance, including cleaning, sanitizing, wearing of personal protecting equipment, if appropriate, maintaining physical distancing, staying home, and isolating if ill. Hand washing and proper respiratory etiquette on top of all of these above recommendations. To date, testing for COVID-19 has occurred in many ways. The following groups have the ability to test for COVID-19: COVID-19 assessment centers, public health units, primary care providers, EMS, long-term care facilities, mental health and addiction facilities, hospitals, Aboriginal health access centers. Testing in Windsor-Essex occurs daily through all of the above agencies, contingent on the availability of supplies and their ability to swab safely. Until recently, asymptomatic individuals were not part of the provincial testing guidance. Mass testing has been conducted by the Windsor-Essex County Health Unit in collaboration with partners in long-term care home, retirement home, shelters, group homes, housing with supports, and among farm workers. Under the new provincial testing strategy, public health will focus its efforts on case and contact management of outbreaks, while Ontario Health will mobilize teams for testing among high-risk settings going forward. Random testing is currently being conducted by the Windsor-Essex County Health Unit to provide a sense of the prevalence of COVID-19 within Windsor-Essex. This is a very targeted screening that's been done at each of these municipalities. Random testing for COVID-19, it's important as it provides better quality data for analysis, planning, and intervention to make public health recommendations. Given that testing every person in our community at a point in time is not possible, a random sample of our community will provide the Windsor-Essex County Health Unit with enough information to make predictions and identify potential trends in the community to make appropriate recommendation that to protect the health and well-being of our community. For more information on testing guidance from the ministry, please review the provincial testing guidance document. For more information about the provincial testing strategy, please review the document Protecting Ontarians Through Enhanced Testing. The job of the health unit is to protect and promote the health of the population. We do this through enforcement of regulations, education, guidance, and support. Public health's most important role is to provide expertise and guidance on the science of population health for local communities to utilize in planning of their program and their response. Thank you.
We'll now take questions from the media. We'll start with Blackburn.
Sorry, I was on mute. No, I'm good for now.
Okay. CTV.
Doctor, Border City Boxing Club is going to allow boxers to train through Boxing Ontario as early as tomorrow. Nothing specific with them, but my general question would be, would you like to see measures put into place for high-end athletes to be able to train at, local gyms, whether it be, down the street or wherever, with their coaches, with their trainers, because they haven't been given that opportunity. So, I don't know, I think that opens the door for that conversation.
There are certain provisions under the provincial reopening which allows some of these competitive sports to allow them for training. So there are some guidelines. Our health unit has put together a toolkit for many of the employers and many of the businesses to reopen. They all need to follow some of those guidance, which includes ensuring that anyone who's coming into the facility, there's an appropriate screening procedures in place, and all the measures that are happening within the facility are in compliance with some of these guidelines, such as physical distancing, ensuring the number of people given in the facility and what kind of training environment that they are in and what kind of protection that they need to protect themselves from each other. So all those things need to be in place, and ensuring that these are monitored carefully. We are our guidance documents, our toolkits are available for help them with the planning. In some cases, these individual businesses have reached out to the health unit to look for specific questions or guidance, and our team has provided those guidance. So I think moving forward, it would be I would encourage any businesses or anyone who falls into the criteria of provincial opening, they should go to our website, look at what is out there to help them in terms of their planning process, and if they have any further questions or follow-up, they can connect with our team, and we'll be able to provide some guidance on that.
So here's the tricky part with that, because you have professional, NHL players or CFL football players who want to train, but they can't train at their specific gyms because those specific gyms cater to the masses, so they can't open their doors. So that's why I asked you the question today, would you like to see measures put into place for those places to be able to open their door and say, we can train you?
I think, those are the conversations that I think we like to have to see how they can open this service for which is legally allowed under the legislative guidelines, and also in the interest of protecting the health of everyone, including the players who are training and also the public. So I think we need to be looking at those specific requests and specific guidance. As I said, I would encourage them to reach out to us for specific guidance. But if you're looking for as a broader strategy, some of these guidelines exist on our website, and also some of the provincial guidelines identify that. But for anyone locally, our team is here to provide them with some support.
Any questions from AM 800?
Yes, are the outbreaks at long-term care homes, is that under control right now, given the fact that we haven't had a case in a long-term care home in a while? Would you consider that under control right now?
So there are 2 homes that are still posted on our website, and I agree with you that we don't have any confirmed case in these facilities. What we are waiting for, which we always do, is we wait for at least 14 days before any new symptom onset or any new case in the facility. So what we are waiting for in some of these long-term care home is new symptom onset that was sent for testing. The moment these test results come back, if they're negative, these homes will immediately come out of the outbreak. But if something different happens, then we'll have to go back to the drawing board, and then we'll have to continue to work on to managing the outbreak.
Okay, thank you.
Any questions from Windsor?
The breakdown of new cases today, community spread among agri-farm workers, close contacts, that was excellent. Is that the kind of thing you could provide every day?
So it really depends on the availability of the information, because depend on when we are reporting when we are getting the results. Our team is dedicated and committed to provide and share information without jeopardizing the Personal Health Information and Privacy Act as much as possible. Sometimes we are just limited by the amount of information that is available to us, but every day we'll try our best to provide you with the information that we have, and we'll acknowledge what information we cannot answer. So I appreciate your comment, and we'll continue to work on it.
Okay, thank you.
Any questions from the Windsor Star?
Doctor, a lot of information that you provided today was sort of going over what the current role of public health is. Do you feel like you have to justify what public health is supposed to do to the community right now?
So what we notice is obviously there's a lack of information. There is a shortage of information, if you want to call it, in terms of the roles and responsibility. And this is the time that we need to have a clear, concise, consistent messaging to ensure that whatever we are providing is understandable and by everyone. We all need to know our role and responsibility. It's not the time to say who is doing what. What we are trying to say in terms of what specific role and responsibility that we have based on the questions that we have received through our Facebook chats or through our questions that people are posing. So we just wanted to make sure that at least people have an understanding of what our specific numbers mean and what is being reported and what we cannot report based on what needs. So I think it is important for everyone to understand our role and our limitation in terms of what we are providing. So this is just an effort to make sure that we're not creating any misinformation, and all these information is consistent, clear, and evidence-based. So we'll continue to do that to help everyone understand some of these challenges that we have, and just wanted everyone to be aware of our role as well.
Thank you.
Any questions from CBC?
Yes, good morning. There is at least 3 protests and marches planned for this weekend in light of recent, events that are happening. Does the health unit have any advice for people that are attending protests or these marches?
I am personally not aware of these organized protests, but I'm assuming that there's been some incident linked to the to U.S. With this person, so there may be protests planned on that. My recommendation would be my heart goes out for this tragic incident, and as much as I condemn that act, but also in terms of people who are congregating, I think they need to be careful what kind of risk that they may put themselves in if they are not appropriately following the public health measures. And in terms of them coming in contact with, if physical distancing cannot be maintained, please wear a mask. Still, the Emergency Management and Civil Protection Act stays. The limitation on people congregating, so I want to be respectful of the protester with their sentiments, but I also want to remind them about what is currently being legislated, and even from their role as the community citizen. We all have a role to play in preventing and limiting the spread of COVID-19. So as much as you want to show your solidarity, your concern, do it in a safe way without putting yourself or anyone else at risk. So I would request you to please make sure that you continue to follow all the applicable law and also your own personal responsibility to your community to prevent and limit the spread of COVID-19.
Thank you.
Any further questions from Blackburn?
You mentioned, I think, on Monday that you requested an autopsy for the migrant farm worker that passed away over the weekend. Did you get that back yet?
I haven't received the result, but again, it goes back to some of the privacy laws as well. What we can and what we cannot share would be something that we'll have to look. But at this point, all I can say is I haven't seen the results.
Any further questions from CTV?
I'm good. Thanks.
AM 800?
Just to double check, I know the long-term care homes were tested once. Have they tested twice yet or no?
So under the new ministry directive, these long-term care homes and retirement homes needs to be tested twice in the month of June. Some of that planning is currently underway, and they are scheduled to happen sometime this month. But I cannot say if anyone has started that proactively. But our team is working with them to provide them with some of the logistic supports. But recognizing that the facilities themselves are responsible for doing all this testing.
Okay, they will be tested twice this month.
That's the provincial direction, and that's what we're supporting them.
Thank you.
Any further questions from Windsor?
Is that every long-term care and retirement home that's going to be tested, or just the ones that are under outbreak?
So these will be all the retirement home, and just a correction if I was not clear in terms of the who will be tested, it would be the employees who will be tested, not all the residents. So I think it's just the distinction is there because these people who are residents, if they're negative and if they are not moving anywhere, there is no need for them to be tested unless they start developing symptom. The direction is for the employees at this point, but as I indicated, based on the assessment of any of these residents, if they develop any symptoms, they will be tested.